And welcome back. Well, integrative medicine is growing in popularity because it's not just about taking pills. It's about treating the mind, body, and spirit.
And here to share the benefits of a more holistic approach is Dr. Rebecca Gallagher with the Watertown Regional Medical Center's Integrative Medicine Clinic. Great to see you this morning.
Good to see you.
Thanks for joining us.
Thanks for having me.
Let's talk a little bit about what it means to be an integrative medicine doctor, and also explaining what's different, I guess, from maybe, say, a typical family physician.
Sure. The difference is that I like to think that I have more tools in my toolbox as a physician. I have more treatment options to discuss with patients, and I also have an emphasis on prevention. I really focus on lifestyle, diet. What do you do on a daily basis that promotes or discourages health?
That seems like it would be a bad thing for a doctor to do, is focus on prevention, because then you wouldn't have as many patients. What made you interested in this specialty?
Well, actually, it was my own health issues. I found that at the age of 29, when I was early in practice, I was having tremendous stomach trouble, and I saw many high-quality physicians, but the answer always was to take more and more medications. And I was on 12 pills by the time I was 29. And the issue is that I was no better. And so I spoke to a colleague who made the recommendation to look at my own lifestyle, and by making changes, I actually got off all of the medications and have no symptoms.
What was the biggest change you made?
Really my diet, and also focusing on sleep. As a physician, you really are sleep deprived, and so focusing on the quality of the sleep that I had really made a big difference.
Good for you. Why do you think there's a growing interest right now in integrative medicine?
I think people really want to take charge of their own health. I think it's empowering to know that you have some control over the fate of your medical future. And so I think that that's a really great feeling. And also they want to know what's out there. They hear about supplements on TV. They learn about herbs by reading in magazines, and having a physician who can give them good, high-quality information is beneficial.
Well, that's what I was going to say. You know, if there's somebody listening today who's been thrown pill after pill or prescription after prescription, and they just think to themselves, this can't be right, I don't feel any better, like you said, is that the type of person who you hope will consult with you?
Yeah.
Or can it be somebody who just wants to be proactive with their health?
Being proactive is a really good approach, but also people who are plagued by chronic medical conditions, having somebody really take a critical eye and say, are all these medications really necessary? Or is there a different way that we could go about it?
And some of those things are allergies, autoimmune conditions. It seems so many people have those these days. Cancer, even. Chronic medical conditions also, like pain, fatigue, diabetes, and heart disease. And that kind of leads me to the next point, which is talking about some great examples that you have of people, starting with Carmen. She lost more than 70 pounds, which is incredible, and also reversed her pre-diabetes and her chronic high blood pressure. I mean, that's an amazing result.
It was an amazing result, and people like Carmen make my job very worthwhile.
It's like she almost looks taller, doesn't she?
Yeah. Yeah, she does.
I mean, just that you can tell that there's a difference about her. Go ahead.
I have the opportunity to work with Carmen at the hospital, and she's a completely different person. And what's amazing is that she's inspired people within the hospital to do the same thing, to really focus on their lifestyle, make some changes, and improve their quality of life.
So cool. And what about John? His cholesterol dropped 40 points, which we all know cholesterol are important. That's an important number to watch, and there's several different keys, I know, to watching your cholesterol.
John came to our One Wellness program with diabetes, and he was really frustrated with the fact that his health was stagnant. And so we made some easy changes, and he actually improved rapidly and was able to go off of his medications. I got a call from his physician that he was thrilled, couldn't believe what John had accomplished in a short period of time.
So off all medications.
All medications,
I think that's such an accomplishment. I mean, that speaks volumes, I think, for what you're doing for people, in the way that you're really looking at all areas of their life to fix some of these underlying issues that are causing all these problems. When somebody comes to you and they want to have a consultation, what is that like? What do you go through?
I go through a lot. Actually, I spend 90 minutes with a patient, which, if you think about it, in the medical profession, that's an eternity.
Yeah, sometimes it's like you see the nurse, you get your blood pressure, you write a couple things, and you're out.
So I really take a comprehensive view of what they do on a daily basis. What's happened in the past? What's their family history? What choices do they make that could be promoting disease development? moment. And from there, we develop a personalized treatment plan that helps them have a guide map for how to move forward.
Let's talk about John, too, another great example and a fun one to share.
Yeah, so John has really committed to his lifestyle of being active. Both he and his wife started cycling together. They bought a tandem bike. You know, I hear about them going around town. It's fantastic. And previously, he had a very sedentary desk job. So a big lifestyle change. I think it's a real testament to what the program is capable of and what integrative medicine can do.
Not just the cholesterol, but all those other things, too, which is fantastic.
Is that what, you know, when somebody meets with you, is that what you're going to say, though? You know, don't eat as many sweets, get out and bike or run. You know, is it that simple, or are there, you know, deeper areas that you can kind of say, this is what's causing it?
That's a piece of it, right?
Okay.
And so I would never say you need to go out and exercise. That's unrealistic for some people, especially if they have physical limitations. We talk about things like botanical medicine, mind-body medicine, using things like hypnosis, meditation to help promote health and healing. The goal is to let the body do what it naturally wants to do, and the body wants to be well.
I think there's so much more information too. I'm glad you brought up some of what some people see as alternative, but complementary I think is a good word, because even massage and acupuncture, hypnosis, all those things I think help people overall just have a better feeling of wellness. It was great to meet you and learn more about what you do, and I know you invite people to have a conversation and consult with you. Again, it's the UW Health Partners there. We're looking at the Watertown Regional Medical Center. It's Dr. Rebecca Gallagher with Integrative Medicine. The phone number there on your screen is 920-262-4639, or you can visit their website as well, which is also there on the screen.
And you mentioned the program One, and that's what people can ask for as well.
Yeah, they can ask for the One Wellness program, which is a full-year multidisciplinary program. They have access to a team, fitness specialist, dietitian, mindfulness, and they actually learn how to get healthier.
It's wonderful. Thank you so much.
Thank you.
Nice to see you.
Thanks for